Hello guys. Today we are going to discuss about a laboratory test called Calprotectin. Use of the test to detect intestinal inflammation, to distinguish between inflammatory bowel disease and non-inflammatory bowel conditions. Example: irritable bowel syndrome, to monitor IBD activity. When you have bloody or watery diarrhea, abdominal cramps with or without fever lasting for more than a few days, then this test is may be necessary. Calprotectin is a protein released by a type of a white blood cells called neutrophil. When there is inflammation in the gastrointestinal tract, neutrophils move to the area and release calprotectin, resulting in an increased amount released into the stool. This test measures the amount of a calprotectin in the stool as a way to detect inflammation in the GI tract. Intestinal inflammation is associated with the inflammatory bowel disease and with some bacterial GI infection, but it is not associated with many other disorders that affect bowel function and cause similar symptoms. Fecal calprotectin can be used to help distinguish between inflammatory and non-inflammatory condition. IBD is a group of chronic disorders characterized by inflamed and damaged tissue in the lining of the intestinal tract. The cause of IBD is not known, but these cases are thought to be due to an autoimmune process that has been triggered by a genetic predisposition, a viral illness, or an environmental factor. The most common inflammatory bowel disease are Crohn's disease and ulcerative colitis. People with IBD typically have flare-ups of active disease that alternate with a period of a remission. During a flare-up, a person may experience frequent bouts of watery or bloody diarrhea, abdominal pain, weight loss, and fever. Between these flare ups, symptoms frequently subside. Many people may go through extended period of remission between flare ups. Calprotectin testing can be helpful in monitoring disease activity. The test is not specific or diagnostic for IBD, but it may be done to detect and evaluate the degree of inflammation. Sample: a stool sample collected in a clean container is required. Normal range: 10 to 60 microgram per milligram of the stool. That is about calprotectin.